Hello guys, welcome channel. In today's video we shall be looking at the pathology of the pancreas. The pancreas basically is our organ which has both the endocrine and exocrine part, and for the endocrine part is what secretes insulin and glucagon that maintains our blood sugar levels, while the exocrine part is what secretes the enzymes that will be important in the digestion of our food in the duodenum. So in our overview here, there are mainly three most important conditions affecting the pancreas, and these are acute and chronic pancreatitis and pancreatic neoplasms. Those are the tumors that can affect the pancreas. In today's video, we shall be looking at mainly acute pancreatitis. To begin with, pancreatitis is basically the inflammation of the pancreas, and when we look at the most common causes of pancreatitis is chronic alcohol use and gallstones. Those are the main causes of pancreatitis. And the other minor causes, they can be viruses like mumps virus, oxac virus. It can be use of drugs. It can be trauma, steroids, it can also be autoimmune diseases, but the main causes are chronic alcohol use and gallstones. So when we look at how gallstones lead to pancreatitis, uh, back to our anatomy, that when we see the pancreatic duct and then bile duct, there is a common point where they meet, which we call the ampulla of Vata. So in presence of gallstones of about 3 millimeter in diameter are capable of blocking the ampulla of Vata, which is the common point where the pancreatic and bile ducts meet, and in turn they will be causing a reflux of the bile back into the pancreatic tissue, and with that it will be causing a destruction of the acini of the pancreas. When we see how alcohol affects, when a person is an alcoholic, there is high chances of them developing acute pancreatitis, but the precise mechanisms are poorly understood how this leads to pancreatitis. But some of the suggestions, it can be ampullary spasm. When you take too much of the alcohol, it can cause spasms of the ampulla of Vata, and that can somewhat lead to a reflux of bile into the pancreatic acini. Second is the plugging of ducts by the inspissated secretion. Then the third is that when you take too much alcohol, it can form toxic metabolites which can have toxic effects to the acinar cells of the pancreas. And in this slide, we shall be looking at the clinical presentations. What does a patient with acute pancreatitis present with? The signs and symptoms here will include: the patient will present with acute epigastric and abdominal pain, which often radiates to the back. Patient will also be presenting with anorexia, that's loss of appetite. You can see nausea and vomiting. So what you should be knowing when a patient tells you they have acute epigastric and abdominal pain and the pain is radiating to the back, the first thing that should come into your mind is that there are high chances of us having a pathology of the pancreas, so you would think of pancreatitis. For the laboratory findings in acute pancreatitis, we find elevated amylase and lipase levels. Of course, these are enzymes which come from the exocrine part of the pancreas. And for the amylase remains elevated for about 4 to 7 days, whereas the lipase remains elevated for longer periods of time. Also, hypocalcemia and leukocytosis are common here in acute pancreatitis. We have looked at this. On our next slide, this is a histological diagram showing how acute pancreatitis looks like. This is a pancreatic tissue to the right with some areas of necrosis. Further in this slide, there is what we call the ransom criteria, which is used to predict the severity of acute pancreatitis and includes two general categories: those at presentation and those within 40 hours of presentation. And what we should note that the presence of 3 or more criteria will indicate severe pancreatitis. So to begin with, at presentation, if the patient is older than 55 years of age, blood glucose levels above 200 milligrams per deciliter, when the white blood cell count is above 16,000 per millimeter, and 4, when the lactate dehydrogenase is above 350. Then lastly, when the alanine aminotransferase is of a value greater than 250. Those are at presentation. Within 40 hours of a presentation, we could get we could see the hematocrit going above 10% decrease, the serum calcium being less than 8 milligrams per deciliter, the base deficit being greater than 4 ml per liter, the fluid sequestration of greater than 6 liters, and the partial pressure of arterial oxygen being less than 60 millimeter mercury. Some of the expected complications of acute pancreatitis: shock is the major cause of death in acute pancreatitis. Someone should note that. Then the second, in case we have recurrent attacks of acute pancreatitis that can lead to chronic pancreatitis. Then lastly, can have a collection of fluid that may be surrounded by fibrous tissue that we call that pancreatic pseudocyst. Thanks for watching. I'm Abdrazak. Don't forget to subscribe to my channel.